Girl was just hit by a car, and the first thing veterinarians do is lift up the lip and see how the gums look, if they're pink or if they're pale. If they're bluish, that means they're not getting oxygen. If they're pale, that means they're bleeding internally. This little girl is kind of out of it because she was just hit by a car, and I'll show you how she has multiple injuries. We put an IV catheter in and we give her a big dose of cortisone and pain reliever if they need it, and then we try to evaluate to see what injuries there are and how we can help her. IV catheter and fluids that we give dogs that are in shock help their blood pressure go up, so we make sure that they get enough blood to all the organs that they need. We can see that she has a big swollen leg that could be broken, could have some bleeding, also a road rash, and she's breathing very hard, so we're going to be looking at her lungs with x-rays.
Just on you for a minute. So what we try to do is we make sure right away if she has feeling in her back end. So she does pull, and she does. I don't want to cause her any more pain, but she is feeling in her hind legs, which means her spinal cord is intact. So we're going to take x-rays and we're going to see what the injuries are.
Dog comes in hit by a car or has other trauma, we x-ray everything. We x-ray their lungs, we x-ray their belly, all their legs, their head if needed, to see if they have any injuries. And you can see she's breathing pretty hard, so I'm going to be concentrating on that lung area. So when we take the x-rays of her lungs, we can see the heart is elevated way above the breastbone or sternum, and there's air that has escaped out of the lungs into the chest. This is an emergency situation. I had to get right in there and suck the air out of the chest to make sure she could make it to be evaluated. So you'll notice I don't wear gloves. It's a quick job. I wash my hands up, we prep her a little bit, and I'll show you how I do that in the next clip.
Chest, catheter, and then we take that off and so drawing out, and then I'm pushing, and you can see she's starting to breathe easier now because we've taken out about 600 cc's. So this is lungs will keep leaking air depending on the hole, so we have to hope that that will seal up. So we can see she feels a lot better now. So actually the syringe is stopped. I can't draw any more air out. So what happens when there's a pneumothorax is we draw air from around the lobes of the lung. So let's see, that made her a lot more comfortable, and you can see her breathing. And let's see if her color got a little better. Well, it's still pale, but it's nice and pink. I'm going to explain to you what a pneumothorax is. If we look in the x-ray, we see the heart, and we see a lot of air around the heart. This is what the x-ray looks like after I sucked out, you saw me suck all the air out of the chest. I've sucked a lot of the air from around the heart. And I'll show you what that means in a model.
Chest. The gloves inside are the lungs, and the plastic glove taped at the bottom is the diaphragm. The way lungs work is that the diaphragm contracts, the ribs expand, and it inflates the lungs by pulling air in. So that's how the lungs work. If there's air inside the chest around the lungs, it won't work so good. And that's what a pneumothorax is.
So what I'm going to do is I pushed a pin down through the glove. Let's pretend like the glove is the lung and that pin is the trauma. So this pin has now made a hole in the lung, a little hole in one of the lung lobes. So we're going to put the lung back into the chest. So when you push on that, the lungs no longer can hold air. And as the dog breathes, actually the air that goes in the lungs collapse the glove. And is to make a hole in the chest and to suck out all the air like I did on the video. So I would actually put a syringe in here and I would suck out that air in the bottle, and actually the body will patch the lungs with fibrin or some of its clotting agents, so that will actually patch. So once I suck out you suck out the air in there with a syringe, then the lungs start to inflate again. So that's kind of what I'm just to show you. That's what how your lungs work in your chest, and your diaphragm is very important. The thing this bottle does not demonstrate is your ribs actually expand. If you breathe and put your hand on your ribs, you can feel it move several inches. So the chest is expanding, the diaphragm's contracting and pulling the lungs to inflate. So there you have it. One of the fun things you can do with a bottle and a glove and some tape. So on this poor little girl, she's got a lot of blood, a lot of bruising and some blood coming out, as you can see. She's probably caused some problems with her femoral artery or femoral vein there. And as you saw in the x-ray, she's got a fractured pelvis and she's got a fractured leg in there. Then also, and I'll show you on the x-ray, when we move her elbow, she's very painful. There's some, you can feel grinding when you touch our crazy bone right here. So in summary, she's had a pneumothorax, air in her lungs. She's got a fractured leg, her left leg. She's got a fractured elbow. She's got a broken hip, which you'll see in the x-ray. So these injuries are all adding up, plus she may have internal injuries. So the owners are calculating out how much money is this going to take. Just for a simple fracture, it could be a couple grand. But for all these injuries, it may be way too much, unfortunately. I can't repair it. It makes me feel bad that I can't. But we usually have to get a specialist in with plates and screws, and they can repair some of these injuries. That's why it's so expensive.
Well, I hope I didn't confuse you. Every once in a while I called the gloves the lungs, and then I said that pneumothorax is when you get air in the lungs, when it's actually when you get air in the chest around the lungs. So realize I was doing that at the same time I was treating the little dog. And I feel bad for her because she had, I didn't show you the x-rays of the elbow, but she had the fractures in the pelvis, and she also had the fractures in the elbow, and she had a hole in her lungs which let her air get into her chest and cause a pneumothorax. And in order to evaluate her, I had to keep her alive with to draw the air out of the chest and get rid of the pneumothorax so that she could be alive to evaluate all her injuries. But in the end, the injuries just kept stacking up, and we were looking at $10,000 worth of surgery, and maybe she would have medical problems after that, and the owners decided not to pursue it and actually put her to sleep. And that's the hardest thing for me, because when you have a young dog that I think we can help, it's sure, I feel so bad for her, but realize that, you know, even after I did a whole bunch of work, she may not be able to get around. So we did euthanize her, put her to sleep, and she went to heaven, and I hope there is a heaven, because I hope that our dogs in heaven, because when I show up, I don't want to just see people there. I want to see my pets too. So thanks for watching. I hope my rambling didn't confuse you. Also realize that I don't prep up when I do emergency procedures. So for those of you that think I should wear gloves every second, when I do a pneumothorax emergency procedure, we often wash and then we try to save a life, and we make sure we use antibiotics afterwards. I just And on the book sign, my website, I just published an ebook called Feed Your Pet to Avoid the Vet. It's more crock-potting recipes for dogs and some nutrition ideas for cats, and that's available on Amazon.com. And enjoy your day. Life is short. Live it to the most. Enjoy your pets. They love you no matter what.